Hello, everyone. My name is David Miller. I'm a medical physicist for GE HeathCare. I'm located in the United States in the Pacific Northwest. Thank you for giving me the opportunity to share with you a bit of information about radiation dose management systems and how they can improve care in imaging. So just a short disclaimer. So when I was going through my medical physics training in the mid-1990s, I'm not aware of any site that had a radiation dose management system for diagnostic imaging. There may have been some academic sites that were exploring this, but it wasn't until about 10 years ago where you started to see these systems come onto the market and become available outside of academic institutions. So I think it's important to take a moment and to step back and review what these systems are and what they're intended to do. So I wanted to share with you first an article that was published by the American Association of Physicists in Medicine. And that's highlighted here at the bottom. Right? And in this article, they went through and they provided characteristics of these dose management systems, what they felt were necessary features and functionality. And also they provided some warnings on how they should not be used in the practice of medical imaging. So what are these systems? Well, they are software. They may be loaded onto servers that exist at your site or onto virtual machines at your site, or they could exist in the cloud. But what they all do is they collect information about imaging procedures. This is often in the form of DICOM objects. They may go out and actively collect data from PACS, or they may receive data passively from imaging devices. Whatever the case, they're collecting this information with the intent to identify the radiation dose indices associated with studies and acquisition information that can help you interpret the data. They have a graphical user interface, and that's what you see here on the left of the screen as an example, to help you parse through the data and to complete a workflow to review cases. Many of them have built-in analytics or business intelligence functionality to identify unusual cases or concerning trends. They may have reporting and alerting capabilities. Some have the ability to give you access to the underlying data. And that can be very interesting and enlightening, right? It's a lot of data at your fingertips, but it can give you insights into how workflow could be improved at your facility, what devices are particularly problematic. You can do your own analytics, your own analysis. It gives you a lot of flexibility if you have access to that underlying data. And many, but not all of these systems will support multiple vendors, and they may support multiple modalities. Right? So certainly CT. Some may also support fluoro and nuclear medicine and mammography and so on. What are the common uses for these systems? Well, the vast majority of the time, in my experience, they're used to look at the site's performance in terms of dose for key exam types like CT of the head, of the chest, of the abdomen, pelvis, and compare those dose values against the standard of care. And what is the standard of care? Well, this is the regional or national benchmark of where doses typically are, right? They're often reported at the 75th percentile of doses for the region or for the nation, right? And we call these things diagnostic reference levels. The tool can also be used to enhance and expand your existing quality assurance and quality control efforts. It can help you identify unusual cases or trends that are concerning that could potentially impact patient safety. And they give you data and visualizations that help you understand what the root cause is for these unusual cases or outliers. Beyond dose, they can help you identify staff that may need additional education and training. and they can help you meet compliance requirements. These requirements may come from your national oversight board, or they could come from an accreditation organization like Joint Commission International. But if you really want to understand why we're spending time and talking about this topic, we should ask the question, really, what is the purpose? What is it we're trying to achieve with all of this effort, with this software, and the time we're devoting to dose management? And if you summarize it, really what we're trying to do is improve healthcare for people, right? If we're not doing that, then we may just be wasting our time unless we're doing basic research. So we want to make a difference in the lives of our patients. So what does it mean to improve healthcare? Right? This can be a difficult thing to explain, how your tool or your algorithm or your software application makes a meaningful impact in healthcare, and how you quantify it. What outcome measures are you looking at to say that this thing is beneficial? So I wanted to share with you a common framework for describing healthcare outcomes. And this isn't something that I came up with. This is something that is referred to as the triple aim. Many countries and organizations that are focused on public health use this framework to quantify the impact of a technology or a treatment or a drug. So there are three categories that have been identified that a solution should improve in some way. Right? And the more categories it can improve on, the better. But the first category I want to talk about is experience of care. Does the solution make care better for individuals, for patients? Does it improve the health of the population? Does it increase longevity while also improving the quality of life of the population? Or does it decrease per capita cost? Right? Does it decrease your labor cost in some way, for example? Or decrease the amount of time that you have to train your staff? So the more of these categories that a solution can impact, the better, right? But what I'm going to focus on next is just this experience of care category. I'll go into a deeper dive with it. But certainly dose management systems can play a role in improving each of these categories. All right, so let's talk about experience of care. There are actually 6 specific outcomes in patient experience that these systems can help improve on. Many sites will buy these solutions to help improve the safety of care that they provide. So a dose management solution can automatically identify high dose cases, and it can help you benchmark your performance against diagnostic reference levels, against the standard of care. So you know, do I need to reduce the dose somehow in my head CTs, right? Because I'm giving more dose than is expected based on the work of all my peers across the country. It can help you provide more effective care as well, because these systems have the capability of monitoring, for example, patient positioning in CT. Is the patient centered? Are my protocols standardized? Am I using contrast in a consistent way? Is KV appropriate for contrast, and so on? Or it can help you identify patients who are at risk of skin effects due to high exposures in fluoroscopy, right? And give them more effective care by identifying them early on. It can help you be more efficient, right? It streamlines compliance activities, it reduces manual effort, and it also gives you the opportunity to collect metrics that give you insight into how performant your site, your device, your staff are. It can help you be more timely in your care, right? So faster computation of complex dose metrics like peak skin dose. Right? It's done for you right away. You're not having to spend hours collecting the data and doing the calculation yourself. You can more quickly identify at-risk patients and monitor them and follow up with them. The data also contains timestamps. So with that information, you can understand how long it takes for you to do a certain type of procedure. These systems can make care more equitable. What do I mean by equity of care? It means that regardless of your, say, gender or your economic status, or the fact that you live in a rural community versus a city, you have access to the same quality of care. So these systems allow medical physicists to monitor and oversee the performance of imaging, whether they're at the hospital where they may be located in the city or in some rural clinic. And that way, the patients at both locations get the benefit of having a medical physicist and a dose team monitor the quality of care that's being provided, making it more consistent. And lastly, these tools can make your care more patient-centric. So we can certainly provide patient-specific dosimetry. We can keep a patient history of dose, which may be beneficial for those who are on some sort of therapy or who have a condition that makes them more radiosensitive. And it allows us to monitor better populations which are more sensitive, like pediatrics. Now, all of these improvements are great. If you can have the right technology, but if you don't have a plan of action, if you don't have a project plan, a plan for change, then you're not really going to see the benefit of these solutions. So it's important that you as an organization understand what your vision is, who's going to be using the system, who's going to be reviewing the alerts, what you're going to do with that data to improve care, who's going to be educated or re-educated, and so on. Right? So it's important to have a plan. It doesn't have to be all-encompassing. You could just start with something small like CT of the head, see how you're doing, make adjustments where necessary, right? And then grow from there. But you need to have that. Just having a piece of technology is not going to do very much for you unless you've got a team that's going to be using it. And you will still have those naysayers who say, I really don't care about dose. I think dose is low in CT. I'm not that concerned about it. What I like to share with those types of people is that dose and diagnostic quality are interconnected. Right? They're very much related. So the things that can cause variation in dose can also cause variation in diagnostic quality. Right? So we know that the amount of radiation exposure can impact the noise. The energy of the X-rays can certainly affect the contrast in the image as well as the dose to the patient. Things like patient positioning and anatomical coverage can also impact both dose and diagnostic quality. So there truly is benefit, even if you don't care about dose, about going through this exercise and optimizing your protocols, optimizing the dose, and standardizing the imaging workflow. All right, so specific features that support improvement. Again, it's important that you have some sort of a low-dose strategy in place to make the most use of these types of features. But I'll just say that the majority of the systems that are out there today will automatically detect unusual cases for you. Unusual cases being that they have a high dose, perhaps a very low dose, or that they have an unusual number of imaging series for the procedure. For example, if you saw that a CT of the head had 10 series, that would make you question whether or not that study was performed appropriately. The systems can give you insight into the root causes behind some of these outliers. So what was the technique? What part of the body was imaged? Who did it on what device? All of this information can help you understand what was the behavior, what drove it, and what can I do to change to make it better. The systems can document that review, which you can then show your regulator or your surveyor that you are monitoring these outliers. In some cases, with some systems, you can actually review the schedule of the day and see which patients are coming up that may have had quite a bit of iodinated contrast or had a very high dose procedure recently. That's not to say that you should deny them the imaging that's been requested, but perhaps there's a slightly different way you could angle the tube in fluoro so that you don't irradiate the same patch of skin, right? Things that you can do to still get the benefit of the imaging exam but decrease risk for the patient. And certainly they can give you patient-specific alerts related to cumulative dose. And again, the example here is high dose cases in interventional imaging. Regarding management of outliers, I think this is an important area. So I just want to highlight that the systems that you look at should be able to notify you in a couple different ways of when these unusual events occur. One of those ways they can notify you is through email, through a customizable distribution list that is modality specific, site specific, and allows you to modify the content of that email, perhaps listing out the metric and the threshold that were exceeded, by how much they were exceeded, and give you additional information like the physician who is performing the procedure or the technologist. In the user interface, you should see a listing of the studies that have been performed and the alert status. And you should have the ability to receive a report that summarizes the behavior of the imaging practice over the last month or the last quarter or whatever time frame makes the most sense to you. This allows you to see what alerts have been triggered, did anyone look at them, and what was the common cause for these alerts to happen. All right. There are a number of advanced features that are out there. Some vendors may not have all of these, but I'm highlighting some technology which can be useful in certain situations, and I'll talk about what I mean by that. But some of these advanced features include organ dose estimation, the ability to automatically calculate fetal dose, peak skin dose, and provide a skin dose map, and to identify unusual cases for pediatric patients. So some examples here. What I'm showing you is an example of an organ dose calculation. Now, I find that academic institutions may be interested in organ dose, particularly for population studies, but for routine clinical use, I'll see sites use this to do fetal dose calculations. That's the common clinical use case. Right? And so here what you've got is the scout of a pregnant patient, and then the associated computational model, which is obviously pregnant, right? And then the system automatically goes and calculates the fetal dose. That improves your efficiency because it's automated data collection and calculation, and allows you to give that fetal dose estimate in a more timely manner, right? So there's less angst by the pregnant patient, wondering about what the radiation exposure that was just received means for that child. But fortunately, in the vast majority of cases, it doesn't have any impact on the course of care for that patient or for the fetus. All right, smart observations. What do I mean by this? These systems can look at the data that they've got in their database and come to some conclusions. So one of the conclusions that's shown here is this study that it was just received of a pediatric patient used an adult protocol. Right? As a medical physicist, it's great if I don't have to go and look at the data myself. I just get a notification that, look, this may be an issue, something you want to pay attention to. Saves me time, helps me be more efficient, and with this information, I can identify which technologists did it, right? And talk with them about it and understand why it happened. And through that process, improve our ability to use patient-appropriate protocols in our imaging practice. And lastly, I'll talk about peak skin dose and skin dose map. So what you're seeing here is a model of the patient, right? You see the dose painted onto the back of this patient. You see where the hot spot is. And the peak skin dose here is roughly around 5 gray, so very significant. And you also see a tool that helps you explore the procedure. So what happened over the course of the study? How many times did they irradiate the patient? At each of those time points, what was the field of view? What was the frame rate? Are any of those impacting the dose the patient received on their skin? This allows you to be much more efficient, right? It saves you hours of time collecting data and doing calculations, helps you be more timely then in reporting the results and identifying these patients so that they can be monitored and followed up appropriately. And because of the data that's contained in this, it can help you identify not only the patients who are at higher risk, but identify high dose behaviors that you want to change by your imaging physicians. Right? So it helps you be more safe in the future. So in summary, we've talked about what a radiation dose index management system is. Right? The question is, can these systems actually make a difference in healthcare outcomes, like safety, like efficiency, like effectiveness? And the answer is yes, definitely. But even with the best technology, you still need a team and a plan. And again, I want to stress it's important that you as an organization have a shared vision of what it is you hope to accomplish, that you have clear roles and responsibilities. So for example, who's going to look at the alerts, what action is going to be taken, right? And follow up on this plan of action that you create, right? So that you can get the full benefit of this investment in technology. So thank you very much for your time, and I'm happy to answer any questions.